Okay, let's go ahead and open up our Washoe County District Board of Health meeting for April 27th, 2023. Can we have a roll call and a determination of quorum?
Chair Dare,
Here.
Vice Chair Reese, Commissioner Garcia, absent. Michael Brown,
Here.
Dr. Danko,
Here.
John Clacking.
Here.
absent. Oh, oh, that's right. And John Novak, absent.
Very good.
Paula Valentine, Recording Secretary.
Thank you so much. Would you stand with us for the Pledge of Allegiance? And Adam, since you're filling in so well, would you lead us, sir? To the flag of the
United States of America,
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice. Okay, let's go ahead and move on to 3, approval of the agenda. Or any questions?
Make a motion to approve the agenda.
I have a motion. Do I have a second?
Second.
Thank you, John. I appreciate it. Any more discussion? All in favor?
Aye.
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 Passes unanimously. Thank you so much. We're moving on to recognitions, and we have some fun recognitions today and a proclamation. So off to you, Senor Kevin Dick.
Thank you, Chairman Dare. I'd like to begin with our years of service recognition, and that's for Ann Sol Trulock, who's got 10 years of service with Washoe County, came to us within the past year. Let's see, where is Ann? There's Ann. Congratulations. Thank you.
Give her a hand. Come on, come on.
And we have a number of new hires. I wanted to introduce Irene Dominguez. Actually, I would like to ask if we could have Jack Zentino. Is Jack here? There he is. Could you introduce Irene for us? And Irene, if you want to come on down and.
Come on down. You're the next contestant on. Thank you. See, she's going to fit right in. We're doing good.
Presenting Irene Dominguez. She comes to us from the Sheriff's Office and a wealth of experience with grant knowledge and a background with SAP, which we're delighted about, and is already doing some positive work. So,
hello, everybody.
Hi there.
Welcome to be here.
Great. Thank you.
so yeah, well,
Congratulations. Stick around. We'll have pictures.
and she can't go anywhere. So.
Thank you.
And then also wanted to recognize Donna Wainscoat, and I don't know if Jen or Lisa, who's doing the introduction? Looks like Ms. Lotritz.
Hi, Lisa Lotridge, Division Director for CCHS for the record. CCHS would like to welcome Donna Wainscoat, a public health nurse in our Sexual Health Investigation and Outreach Program. Donna was born and raised in Reno. She attended Orvis School of Nursing and has been a registered nurse for 18 years. Prior to coming to the health district, she worked for the largest surgical group in Northern Nevada and was focusing on patient care, pre- and post-operative teaching, triage, and wound care. We're very happy to have her join our team.
Welcome.
Welcome. Thank you. And then I'd also like to ask Dr. Dow to introduce Jordan Markey to us.
Hi, for the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. I would like to introduce Ms. Jordan Markey. Jordan started this week as our new Public Health Emergency Response Coordinator for the Healthcare Preparedness team under our public health preparedness program. Jordan has previously worked with us as an intern and later as a temp staff supporting COVID-19 post and pod operations. Jordan's originally from Brentwood, California. She graduated from the University of Nevada, Reno with her master's in public health. Her most recent role was with the CDC Foundation and Nevada Primary Care Office, where she helped address the healthcare shortages in Nevada. So welcome, Jordan. We're so glad to have you.
Thank you. And then we also have Alexander Messinger-Patton and Ryan Vogler, who we had on the agenda, but they were starting the Monday after the board meeting last month, and we're striking out this month because they're at their visible emissions training. So working hard and getting up to speed already, but glad to have them on board in air quality. For promotions, I wanted to recognize Nanette Kano, and I'm not sure if Nanette is here. Not here? Okay. She's been promoted from an office support specialist in administrative health services to an admin secretary in air quality management. So great to see her moving up in the health district. Congratulations to her. Also wanted to congratulate Jennifer Howell, Jen, who has been promoted from health educator coordinator to public health supervisor, effective today, I believe. Hector Mendoza Marin, is Hector here today? I don't think he is. He's being promoted from an office assistant 2 to an office assistant 3, moving to the assessor's office. And also Daisy Rodriguez. Daisy, if you could wave. Daisy Rodriguez has been promoted from a community health worker to a public health investigator in our community and clinical health services. So congratulations, Daisy.
Congratulations.
And wanted to also recognize our health heroes. Jackie Lawson is being recognized for demonstrating our health district values. Jackie, there she is. And Jackie's actually has 2 Health Hero Awards. So congratulations for that recognition by your peers, Jackie. Ian Check is also here from EHS for Health Heroes Award. Jesse Salem, also in the back next to him, from EHS, and Narcy Perez Zapata on the end of the aisle is also here for Health Heroes Award. And we have 2 honorable mentions for Health Heroes. One is the entire WIC office, and also Salvador Garcia from EPHP, an honorable mention for Washoe County Health Heroes. And then we also are recognizing today our health equity team, and Washoe County has an Impact Awards program, and our team was recognized for quality public service for the health equity initiatives that they've been implementing, and I want to run through names and have people raise their hand for us. Camarina Augusto, Yara Diavola, is she? There she is in the back. Eva Leon, Lisa Latritz, and Itziana Montoya, Jasmine Olvera, Scott Oxerart, Scott's in the back. Julia Ratty is not here today. Daisy Rodriguez again. Christina Shepard and Kayla Solario. So congratulations to all of them, and hopefully Scott has got the award to bring down for pictures here in a few moments.
I want to pause that for a moment just because, I think it's real important that we take moments when you guys just rock it and do a great job for our community, because it's not just what you do for the health team here, it actually is for the community. So thank you so much. And just know on behalf of the board, thanks for representing us well. I know that everybody else is here. You're all heroes of some sort, but these guys really, really stepped up and made some notice and making some good waves. So thank you.
All right. So that's what I have for the recognitions, and I would like to then move on to proclamations. I'll run around front for that. So today we have a proclamation for EMS Medical Services Week. Whereas EMS Medical Services, actually before I get started with this, I think we've got a bunch of EMS people here. Perhaps they could come down and join me. EMS.
Don't be shy. Come on.
And maybe Sabrina and the EMS team.
Thank you all for being awesome.
And Sabrina, I'll let you manage these. All right. Thank you. Whereas emergency medical services personnel are called upon to help others through one of the most frightening times of their lives, and whereas emergency medical services is a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week. And whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury. And whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure those in need receive the highest level of emergency service. And whereas the EMS commitment to patient care throughout Nevada has been an integral factor in our safety and security, and whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Reno Tahoe Airport Authority Fire Department, Pyramid Lake Fire EMS, REMSA, and CareFlight operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and accomplishments of emergency medical service providers by designating Emergency Medical Services Week, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 21st through 27th, 2023 as Emergency Medical Services Week with the theme, Where Emergency Care Begins. Adopted this 27th day of April 2023, Christopher Dare, Chairman, Washoe County District Board of Health.
Very good. Thank you. And I just also want to add to that. That goes to your families. And I say that we know very much that the sacrifices are real. You're working nights for some, and you're working holidays for some, and you're running towards things when we all get to run the other direction. So we appreciate it and we thank you. And please give them a good hand. Do any of you want to do a speech or sing a song or anything?
You want to make any remarks?
Adam's great at it.
Okay. We'll come down for a picture then.
Yeah, let's.
That's an action item.
Oh, it's an action item. I'm sorry. Thank you, C. Thank you. Can I have a motion on that?
Make a motion to accept proclamation as presented.
I have a first. Do I have a second? Dr. Danko or John Clacken, would you like
Yeah.
to second that?
Second, Rika.
Thank you so much. And all in favor?
Aye.
Aye.
It passes unanimously. Thank you.
All right. I think it's picture time.
No?
Carry you down there.
Thanks, everybody. Really appreciate you guys coming over. All right, thank you. Mike, we got more. Yeah, let's start with Ann. New employees? Yeah, new employees. Ann, if you want to come on down for years of service, and then we'll get the new employees after you.
10 years of service.
I got a pen and I got a certificate.
You get to take center stage.
There you are, and there's your 10-year pen. And this, then we've got Irene and Donna. Irene's in the back. Let's go with Donna, since you're right here.
Welcome. So this goes on your living room.
Over my fire.
Jordan? She's coming back.
Oh, that's right. Welcome back. She looked familiar. Like Terminator, out of 3, 5.
All right. Irene?
Tell you, gonna watch out for this one. See you. I don't even know her. Welcome.
Thank you. I'm so great.
Yeah, she was like this right now.
Yeah. She needs to plan your next part.
And how about Jen? You, Daisy? That's Jen there. Congratulations. Is it today? Yeah. Health Heroes?
You get the Health Heroes next, please?
You don't got 2 parts. You need a picture of the whole group, just to see what else.
And Jackie, come on. Do we want to
We all
do a group shot?
together.
Yeah.
All the health heroes in the village. You have to stand extra high, because you double your staff.
I'll do that private.
Pretty wild how a little kite.
Nurse?
Wow, that's amazing. We're cut.
Jackie,
Good job.
you got 2.
That's
One in each hand. Yes. Thank you all.
Come on over.
All right. Then,
Thank you guys.
congratulations.
Jackie got 2. She needs 2 pictures.
Now, the Impact Awards, the
We need
Health
this
Equity Team,
cool squad right here.
and we have the award. Who's going to take the picture? Scott's got to be in this one.
I can take a picture.
I know we were sending the, maybe if you have a mess, but we were sending in, you guys are in trouble now. We'll be like, get that team together.
I guess who else can take the picture?
thrill in that, actually.
I'll do it with you.
Dr. Danko and John Clacking will go ahead and just digitally put your faces on those pictures. So thank you for being here.
Sounds great.
Okay. We are now open to public comment. Do we have any public comment?
No public comment.
Thank you so much. We'll move on to consent items. Anybody want to pull anything, have anything to talk about, or I'm looking for a motion?
Motion to accept consent items as presented.
I have a motion. Do I have a second?
Second, Rika?
All in favor?
Aye.
Passes unanimously. Thank you. Okay, we're moving on to our presentation, discussion, and possible selection of the Northern Nevada Public Health logo. And so hopefully you guys online, it's in your packet, so you can kind of look at it. I think you might see it in some of their display that they're going to put on as well. But I'm excited to bring this forward and start moving on this. Scott, are you the man?
Okay, thank you very much. Scott Oxerhart, for the record, Communications Manager at the Washoe County Health District. We will be joined hopefully shortly by the Abbey Agency, which was the contracted vendor to help us through the name change and the outreach process. But first, I just kind of want to give the board just a kind of a timeline of the events that have occurred so far, and then give you a little update about what you're going to see with the presentation. So it was in 2021 where we got board approval to move forward with the name change. Northern Nevada Public Health was selected. Soon after that, we put out a request for proposal to hire another agency to help us with the outreach process of that new name and the brand change. We had the RFP open for about a month. We worked with the comptroller's office, had over 10 submissions come in. We had a committee that was assembled through the health district, but it had members from the city of Reno, city of Sparks, and Washoe County to give us, again, this is a regional brand process, so we wanted to get their input. The Abbey Agency was selected out of that group. About less than a month after that, we got the contract going with them, and we had our first kickoff meeting. That was in November of last year. So here we are a couple months later, finally ready to kind of show what the work the Abbey Agency has done. In the past few months, we've had multiple meetings. Chairman Dare, you've been a part of a few of those, Kevin Dick, myself, and other members of the communications team, specifically Yara Diavila, to try and give Abbey Agency basically the knowledge that we have just from the health district's perspective of where some of the issues were, kind of the background story on why the name change was requested, and where ultimately we want to go. As I've said up here before, while we are changing our name, we are changing our logo, our website, our colors, the signage on the side of the building. Ultimately, we view this as a public education campaign. There are still way too many people in this county that don't know the services that we offer. So while there is a new name and much of the effort will be to help people understand that name, it also is to remind them of the services we provide, specifically to those that are low income. So we want to make sure that gets captured. That's really the background. I'm happy to take any questions. Otherwise, I can pass it to the Abbey Agency to give you guys the two logos that they narrowed it down to that ultimately we hope you will select. And I'm happy to take any questions before that.
I don't know if anybody has questions. I do want to say that what we're going to see here are two options. We looked through them, and I requested that we have at least more than one option that we looked at. So we did narrow it down to two. So with our team and the committee that we had, this is what we came up with. We're definitely open to any conversation. We want people excited about it. We want our board to know one day when you look back and maybe you don't even serve on this board anymore, you knew you made a difference and helped. But I do like the point you made is that we really use this as a leap forward of communication, education, and I think that is a great way to look at it.
Absolutely. And like I said, so showing you just two logos side by side oftentimes doesn't really give you the perspective and the foresight kind of when looking into this. So that's where I'm going to bring in the Abbey Agency and Warren Fan, who will start it off. And we also have Tucker Monticelli, and it looks like we have Ty Whitaker, who co-owns the Abbey Agency. The thing that you are going to see, it is a presentation. It was in the agenda, so it's public, it's out there. But there's options to look at that have some of the branding kind of in the wild, as we would say. It's on some letterhead that's in a picture. It's on some like a picture in the background with the logo on it to hopefully give you some perspective of what it will look like in some of our ads going forward. So with that, I'll pass it to Warren Fan.
Thank you, Scott, for your time and introduction. Hi, everybody. We are the Abbey Agency. We've been so blessed to be able to work on this project in collaboration with Scott and team, and also the chairman as well. And we've gone through so many iterations and gone through so many opportunities to really explore the gamut of the logos, and really came upon two great options that we think really identify and really depict and really help tell the story of Northern Nevada public health. And I'm going to pass it over to Tucker. He's really going to go through two options. There's going to be, like Scott said, opportunities for you to see it in the wild where it may live. And it really kind of gets you really seeing it in your area. So I think it's really exciting to be able to really see it where it could be something that's used on a t-shirt or on marketing collateral. So Tucker, take it away. I will share my screen. Give me 1 second. Scott, can you provide the opportunity to share my screen, please?
They're working on that.
I will delegate that to Susie.
While they're doing that, I'll introduce myself. My name is Tucker Monticelli. I'm the art director here at the Abbey Agency. I'm going to go over some of the logo choices with you guys, explain some of the thought process behind it here. So for our first concept here, typography for the logo was chosen to be authoritative yet approachable. The logo uses Termina for Northern Nevada, which is a strong geometric typeface. Public Health here uses Roboto, which is used as a geometric typeface, but at the same time, it features a friendly and open curves. The color here was chosen, the blues and this very approachable gradient style. We didn't want the colors to feel too hospital-like, since the mark represents the overall health of a community. The gradient going from dark blue to light blue was an intentional move to leave you with a sense of hope and inspiration. The primary colors in the logo are then paired with bright and friendly secondary palette, which can be incorporated while branding collateral for the brand. The mark, the logo, we wanted the mark to be incorporated into the type for a simple, clean logo that is easily scalable on digital and print pieces. You can see here that it features a cross. This mark is easily recognizable for its representation of health. The 4 points to the cross are representative of the 4 departments within the Northern Nevada Public Health coming together to serve the community. The element can be used as a watermark in any of the collateral for the brand in the background of collateral. So that's for that guy. You can see there's some iconography for some drop marks. Here's our colors and secondary colors. And here's a little bit of what we like to call a brandscape of how it will live with imagery. And here's some collateral example. You can see some of that watermark usage here. And some more collateral as well. For the second concept here, we have what you can see is obvious Nevada references here. The state of Nevada kind of put in a concentric circle. It's reminiscent of a pinwheel type structure that denotes health and a bit of innocence. It's got a bit of continual movement that kind of represents continued care, a cyclical idea of full coverage, encompassing care. The colors here were chosen to be bright, expressive, uplifting, and energetic, as well as approachable. And then the typography here was chosen to look authoritative and like they were a leader of the subject matter, but in a way that still feels gentle and unobtrusive and approachable. You can see it also features that same cross with the same principles. The pinwheel type structure also includes 4 colors that were chosen to represent the 4 different aspects of the public health, the Northern Nevada public health branding. And these 4 shapes pulled together was a different way of forming that cross structure. And here again, we can see the primary colors, very bright, vivid, and approachable. And again, a brandscape showcasing how this branding can live with a very bright and vivid photography. Yes. And here's some collateral. Also, this one uses a watermark as well in the background, a bit more colorful this time. And here they together as a comparison for you guys to take a look at.
So those are our 2 concepts. So we're open to questions. I can share my screen again. Would love, just any open feedback for our team.
Let's go and open that up. We'll start online. Dr. Danko or John Clacking, do you have any questions or thoughts?
Thought they were both very good. Hard to choose between them. From my standpoint, I like them both.
Very cool. They like to hear that, I think. Dr. Danko, do you have any thoughts?
Yeah. My only thought is that in both designs, I mean, I agree. I like them both. Both of them, if you look at from a little bit further away, or squinted, it just looks like the only part I can see is the public health. To me, I think the Northern Nevada part highlighting our region and our service area is equally as important as highlighting the fact that it's a public health mission. So for me, but that might be just a personal opinion, I think Northern Nevada is very small in both of these compared to the public health.
Okay.
I think that's a good point from my side too. I'd agree with that.
I think one of the things that we did wrestle with, we had a lot of different things we looked at, but having 4 very large words that we're making a logo out of makes it interesting. Just if you saw all the stuff we saw there, it was interesting rotating. But I do think I do want to say thank you to the Abbey Agency for taking so much time to walk through this. Mike, do you have anything any thoughts?
I got to say, both of them, they look great. The comments that our other board members made are right in line. I want to know what our employees think. They're the ones who are going to be serving, in these capacities and representing our public health. And we had members on the team from our employees when we started looking at the. Okay.
We had our communications team of Yara and Scott that worked with me and the Abbey Agency, and then Christopher Dare. So we haven't done a poll of the staff. These were sent out to them when the agenda was posted last week, so they were aware of what was being considered by the board today.
And I think, Scott, if you want to speak to that too, that was actually what you just said was my main question. I'm not wearing the shirt that says it on it. You are, or the business cards. I do lean towards the first one. I think even in digital print of what we do, I think that first one probably shines out a little bit more with the little blue health signia and some things you can do with it. But I'm comfortable with either one. But I'm very interested, as our other board member said, what you guys are thinking.
Well, I think at the risk of getting things thrown at by employees, we really wanted this to be a process that was handled by the vendor we chose. We invested a lot of money in this change. We wanted to do it right. We did, like Kevin said, we sent out the logo last week to give employees some time to look at it. I received some feedback, like one or two like text messages, not really, in support of one or the other, just kind of some questions about kind of why it was chosen. But overall, from the get-go, we really wanted to focus on the subject matter expert in this case, and that was the Abbey Agency. So we were comfortable with the ones that they proposed.
Do you have one that you prefer, you guys think?
Honestly, I could go with both.
Gotcha.
That was my main goal. Was hopefully we would be in a position where whichever one the board chose that I'd be happy with, and I can honestly say that I would be happy with both. I think it kind of depends on what you guys really want. I mean, the concept one on the left is a clean look. It's got Northern Nevada Public Health. It's got the blue. The gradient is definitely something a more modern approach, which I like. And then concept two, I think, we've always said the struggle with this logo was trying to blend in our organization's role as, in permitting and compliance and being the public health authority to protect people. So we have to have something strong that when, again, people wear the polo or going into a restaurant for an inspection or to a pool or just out in the field in general, that they have to have something that shows that authority that we are here to protect people from a lot of different things. But on the other hand, health equity, outreach to underserved communities is such an important role in what we do. And a lot of those in that audience rely on us for those services. So concept two is definitely more accommodative. It's got the colors. It's almost like open hands, like saying, hey, if you need help with something, let us help. Like we have these services. Every time we send out a press release on our vaccines, whether it's for COVID, but even just back to school, like if you don't have insurance, don't worry about it. Like still come to us and we will get you those vaccines. So there's two really important roles that we serve, and trying to get both is extremely hard. I think everybody can acknowledge that. But ultimately, I think you could go with either one and we can still achieve the goal that we have in upholding those roles that we have for the community.
Mr. Dick, do you have anything you'd like to share before we just let the board make a decision?
Well, I agree with Scott. I think they're both very good logos, and I know the Abbey Agency has put quite a bit of work into this, and to come up with these two that were the top ones in our view. I can tell you that it's not scientific on what I'm going to tell you. I have been careful not to tell anybody what my favorite one is, and I'm good with either one of them. And I have heard from staff that comments that they both look good. I think I've heard more comments that on the first one that people liking and saying, "Oh, that I like that one." But I have had comments also on concept two with people liking that.
Okay. Well, with that said, there's 4 of us on here, and we get to make this great decision. That's what they pay us all the money for, being here for. So would someone like to make a motion?
I'll make a motion that concept one be the new adopted logo.
So we have concept 1. Do I have a second on concept 1?
I'll second for concept 1. Rika?
Any more discussion before we vote? Okay, all in favor?
Aye.
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 Okay, that passes unanimously. Now you have your marching orders. Ready to have some fun? Thank you so much, and thank you, board, for doing that. I think it's important. I do want to say thank you to the Abbey Agency. They really walked with us, and to Scott and the whole staff team that stepped up. So thank you guys. The process was great. Appreciate it.
Thank you for your time, board. And we're so excited, and we got our marching orders, so we will be connecting with Scott ASAP.
Thank you so much.
Thank you. Have a good one.
Thank you, everybody.
Okay, we're going to move on to our regional emergency medical services conversations. We have a few of them today. So Adam Hines, I know you're here representing today.
Good afternoon, Adam Hines, Chief Operating Officer, Remsa Health. In for Mr. Duplantis. Before you, you have our March report. If I may supplement with some more recent information. As you see, our performance this past month was 94% compliant in Zone A and 93% in B, C, and D. Annually, our organization remains compliant at 91% in both Zone A as well as B, C, and D, and are happy to report that we are trending and performing well for this current month. I'd like also to take the opportunity to thank our operations leadership team who are working extremely hard at ensuring our deployment plan, schedule, and team members are strategically positioned to optimally serve our community. In addition, I'm pleased to report that we have a new shift bid that goes into effect May 21st, so the week of EMS week, with 68 ALS shift lines. That's the most that we've ever had. In addition, this past month, we are pleased to re-welcome 3 team members back to our organization who have left and decided to come back. And I know that's been a conversation of the board. And so I think it's something that is very important to Barry and I. And when somebody decides to come back to the organization, we're very proud of that. And then finally, at the beginning of the month, we celebrated our hardworking, compassionate, clinically excellent emergency telecommunicators during Telecommunications Week. 6 of them were nominated for Dispatcher of the Year at the annual International Academies of Emergency Dispatch Conference in Denver. As Brittany Pickering, Ashley Harris, Jennifer Wooster, Amanda Roulier, Ralph Torres, and Ashley Leone. In addition, Communications Director Chris Barton received recognition as our center was reaccredited for the 8th time, so nearly 23 years as a center of excellence for the provision of emergency medical services. And so with that, I appreciate the additional time, Mr. Chairman, and I'm available for any questions.
Any questions from our board? I do want to say this, you know, we really do look at compliance, and this is one of the things why this comes to us, and good job. And I know it seems like one of the highest we've seen in a long time. And I think, as you're right, as you staffing, a lot of things, and hopefully it continues to get better and better in the sense, and hopefully you feel that support too.
Thank you.
And with that, this is an action item, isn't it?
I'll make a motion we accept the report as presented.
I have a first. Do I have a second to accept this report?
Second.
I have a second and a third. All in favor?
Aye.
Aye. Thank you so much.
Thank you, sir.
Now we have an update of Remsa Health's public relations during March 2023. Alexia Jobson.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Director of Public Relations for the record. You have for your review March's public relations report. I'd like to share a couple of other more recent updates with you. In early April, Public Education Coordinator Alma Marin provided a Spanish language interview to Telemundo Reno about the importance of learning high-quality CPR and the availability of Spanish language CPR classes in our community. 2 weeks ago, Remsa Health hosted about 45 people from NCET, a local business and technology networking group, and toured them through our key divisions, including education, ground operations, and dispatch. We received very positive feedback, and participants were thrilled to learn about how Remsa Health cares for the community. And because it wouldn't be a monthly public relations report without me bragging about a group of our employees, I am proud to share that 4 Remsa Health employees were invited to present 8 sessions at the recent International Academy of Emergency Dispatch Conference on topics including key performance indicators, implementing an emergency nurse communication system, quality assurance, planning meaningful employee recognition events, and other topics. I'm available to answer any questions you may have. Thank you.
My main question is, don't we have an event coming up next month?
Yes, we sure do.
Can you talk about that? Because
Yes.
we want to make sure that everyone, all our board comes, and we hopefully can get that out also to those that are not here today.
Yes, so you should have received a save the date, and invitations are forthcoming, but Monday, May 22nd kicks off our EMS week. And we will have a week of events for our employees, and all of you, of course, are invited to join us for our awards celebration lunch, where we will be honoring and recognizing and celebrating our EMTs, paramedics, nurses, and of course, our administrative staff that keep us rolling and flying and caring for our community. So lots of information will be coming your way, but please definitely mark your calendar.
Thank you so much. Any other questions or thoughts? No, thank you so much.
Thank you.
We have a presentation, and this is of the REMSA Health Regional Emergency Communications Accreditation Center for Excellence. I asked this personally to come to us, and so for those who aren't here, Adam, you and I might be taking them to lunch. We'll sit down and make sure they understand it as well. But I do want to make sure that this is a conversation. It's a conversation happening in our region at large, but I think it's important we understand it very clearly, and that as decisions are made in the future, and I say this before he starts, I've always been a part of school accreditations. Accreditations, period, help hold things accountable for long periods of time. And so for me, this accreditation that we have in our region is important. And it's something that I'd like to see us find ways to uphold. And however that looks in the future, it means that that's in place as far as I'm concerned. So I appreciate what you're going to share and learn us.
Thank you, Mr. Chairman. Adam Hines, Chief Operating Officer for REMSA Health, and I appreciate the opportunity. A lot of dispatch talk today, a lot to celebrate in our region. That's okay, thank you. I know are we good? Is this the? Great, thank you so much. We just switched it out. There's pictures of team members. When I looked on here, I didn't see our team members, and that's probably the most important part. So thank you for entertaining. So if I may start off with, dispatch in our community has evolved and has changed many different times. And I think it's important. This is obviously simplistic. Our dispatch is in our region is very complex. It's comprehensive, and every single center, I think, is interested in providing high quality, responsive, and professional care. But as of current, and again, this is a little simplistic, when a community member calls for help, 911, they get the primary PSAP, or the primary service answering point, or public service answering point, and that would be either at Reno Public Safety, Sparks Communications, Washoe Communications here in our region. Each dispatch center has a different protocol as to how they process those calls and the information they're getting. Some will ask what's the address of the emergency, what is the phone number, what's going on. Some will just ask, do you need police, fire, or medical, and get the address. Others may get into whether or not the patient is male or female, their age, whether they're conscious and breathing. And so there's different things that happen based on which PSAP that person receives. One of the things that I think is important, and many of you are involved, is the regionalization project. And some of our colleagues are here. My colleagues are here that are working on that. And I'm very proud of the work that we are doing to try and streamline that for the callers so that they know what to expect, we know what to expect, and we can really reduce some of that duplication and reduce the time it takes to process those calls. On average, it takes us about 8 seconds to answer those calls, and then we're on the phone for about 5.5 minutes providing care until either our co-response partners arrive on scene or REMSA Health arrives on scene, or if that patient is transferred over to our nurse, we're warm transferring. And so those are kind of the things in which occur, again, very simplistically, but important for us to understand. Having the ability to take care of those patients for that 5.5 minutes with our dispatchers allows for our primary PSAP partners to be available for that next fire call or for that next medical call that's going to come in, or police call. Once the calls are received, and REMSA receives those calls through the primary PSAPs as well as individuals that may be calling non-emergent lines, there's a couple of ways in which we manage those calls. Obviously, what we're most familiar with is sending an ambulance. For a long time in our community, it was just an advanced life support ambulance. And more recently, we've added a tiered response, so we're able to appropriate the most appropriate care. Some patients need critical care, and so we have the ability to dispatch care flight, as well as we dispatch for Truckee Meadows Fire Rescue. One of the things, and I'm going to get into it because obviously this specifically is about the importance and the privilege of having an accreditation, is our nurse health line. Our nurse health line, we've been accredited, we've had an accredited nurse health line for many years, and in order to transfer patients safely, you have to triage them appropriately. and then you are able to transfer them over to a nurse who then can find them the right level of care. That reduces the burden on the emergency service system. On average, 97% of the patients that are transferred over to the nurse stay with the nurse, and that nurse provides either over the phone care for them or gets them connected with care. It's not that they don't need care, just they do not need a paramedic ambulance or a fire rescue to respond. And so less than 3% of them actually come back to 911 because of acuity. And the way in which we are able to do that is because of our accreditation, because of the standard in which we have set. I think it's also important to talk about, why do we have an accreditation? And quite frankly, a couple of these things, standards were set by this board that said the standard of care in our community is going to be these things. Number one, 5.2 of our franchise indicates that we're going to have a central emergency medical dispatch center, and that is REMSA, and so that we can regionally manage patients wherever they are. 9.1 talks about our dispatcher training. All of our dispatchers are medically trained. That's not required by the academy. That's not required to have that ProQA software or do it. That's an additional layer. That's an additional standard of care that this board and our community has had set forth for many, many years. And so our people are either minimally trained at the level of EMT, some are paramedics, some are still practicing people that work in the field as well and are still providing care, whether that be in the seat or in the street. And then 9.2, the purpose of why we're here is the dispatch accreditation. It says that we shall maintain accreditation through the national, it's now International Academies of Emergency Dispatch. We're very proud, like I shared earlier, we're very proud of going through our 8th accreditation cycle. Actually, there's only 2 here in Northern Nevada, one at REMSA Health, one at Douglas County Communications. And we've held that accreditation since 2001. We were the first in the world, very proud of the care that we provide here, the first in the world, to get ACE accredited for our emergency communication nurse system, which is essentially the ability to send over to the nurse and have nurses trained to provide care. And then our dispatch team is working very hard at emergency fire dispatch, and I'm hopeful that in a couple months they can come to you and tell you that we have been accredited for emergency fire dispatch. So one of the things is why would we commit to this? And it's just a proven way to maximize accuracy, to ensure effectiveness and efficiency, as well as to ensure that we're providing the highest standard to our patients and to our community. There are many different accreditations, and really what accreditations say is you're going to meet certain standard, and we're going to make sure to check on that. How they do that is there are 20 points of accreditation, and that's kind of a misnomer because each 20 point has probably 4 or 5 sub-bullets, so it's like 100 points, so it's a lot. I hope you're here for a while. No, essentially those buckets it makes sure that our team members are credentialed, that they should be providing that care, that our protocols are up to date, and we're providing relevant instructions, the most up-to-date instructions, whether that be medical or fire. That we have a quality team that is looking at and providing oversight as to what we do. And in addition, those calls are sent out to the Academy for inter-rater reliability so that they can say what you're doing is exactly what you say you're doing. And that there are a minimum number of calls. Each quarter we have to share with the Academy how many calls we are reviewing, what the compliances of those calls are, and there's a minimum. And I'm very proud to say on the EMD side, we have always met compliance. And so I'm very proud of that, and I'm very proud of those team members. In addition, it's about community education, it's responder education, it's ensuring our policies are up to date. So, it's very easy what we do could be, and this is something in which I think sometimes the public doesn't understand, is when they call somebody, there is a constant evolution to ensure that what we're doing is aligned with best practice, and that's what the accreditation does. The other thing that it does is it ensures, at least on the medical side, it ensures that there's physician involvement. These two are our medical directors that are on staff, Dr. Jeremy Gonda, Dr. Jenny Wilson, brilliant, wonderful people that are actively involved in the way we provide care. That's starting with the call and ending when we transfer over to the hospital. Because dispatchers aren't just pushing buttons and sending people, they're providing care over the phone. One of the things we like to say is care starts with the call, and one of the components is dispatch life support, and that is administering medications to people that may be having a heart attack, like aspirin or naloxone or EpiPens, ensuring that when somebody's in cardiac arrest, we bifurcate. And when I first started, we did mouth-to-mouth and chest compressions, and as the science evolved, we changed that. Depending upon the reason or the suspected etiology, we're going to go straight to the chest and we're going to give chest compressions, or we may do rescue breathing. That's all led by our physician team. In addition, they actively participate in education and quality assurance so that when somebody calls, they understand that our physician team is involved in that. And quite frankly, you know, we talk about response times a lot. When you get a medically trained, accredited emergency medical dispatcher, for many of the things that science says makes a difference in those emergencies, our response time is 0. There is a paper from the National Association of Emergency, it's out of pre-hospital emergency care, so that's actually the journal of the National Association of EMS Physicians. And one of the things it talked about is how often are life-saving interventions occurring, and on average it's less than 7% of the time. But the things in which are considered life-saving, many are things in which our dispatchers do over the phone. BLS airway, administering naloxone, EpiPen if that's available, CPR. I walk through the dispatch center twice a day, and the other morning one of our team members was really excited, and she said, one of her colleagues took a phone call. It was for an elderly female. She was having chest pain, and she went into cardiac arrest on the phone. Immediately, they were able to instruct that caller to do chest compressions, and when our paramedics and co-response partners got there, they were able to get return of spontaneous circulation. That is somebody that was saved as a result of dispatch-led care. This is one of our team members, Natalie. She's been a dispatcher for a long time. She started in Florida. The other day, she got to help a mother deliver her first child. And so it was a baby girl, healthy, and she was very excited. That is also the type of care that we provide. I want to share with you a couple comments. So like I said earlier, we receive calls that are go under quality assurance and are reviewed by our team. But we also send them to the academy to be reviewed to ensure that what we say we do. And here are some of the comments from one of those reviews. Fabulous customer service, and one of the quickest that they have ever done. That's one of those points, point 10, that they've done because it was done so well. And so I just want this board to have a ton of confidence. This accreditation ensures that we have high standards, and Remsa Health is very proud to meet those standards. Accreditation allows for us to do things. There always will be emergency responses. I know we talk at this board a lot about navigating patients, and there is a large majority of our patients that do not need emergency ambulances and fire units and police cars. There will always be emergencies, and we need to be prepared for them. But what we also have to do for the future health of our communities we serve is we've got to better allocate resources and match it to the right level. And accreditation allows us to use evidence-based process, algorithmic, that is confirmed by external bodies to ensure we're doing it safe, we're doing it effective, and we're doing it based on the science. This is that slide that I added because it's not really important that I stand here and talk to you. It's about the team members that provide that care every single day. And here are individuals that have been on our team and that currently work for Remsa Health that are providing that care when somebody calls 911. These are the individuals that make our accreditation possible. These are the individuals that have high standards, and I'm very proud of them. So with that, to wrap up, the question that was asked is, what does ACE accreditation, or what does that accreditation mean to us and to our community? It's an external way to validate performance. Obviously, you, as our governing board, want to ensure that what is being provided to our community members is of the highest caliber, the highest standard. Accreditation helps us do that. It's a promise to our community that Remsa Health will provide the highest level of care and professionalism. It's evidence-based, it's standardized, and it's a safe way to provide care over the phone. Quite frankly, it's an industry practice. There's thousands of agencies across the world, 2 of which are in Northern Nevada, that have committed to accreditation. It's an international way for us to benchmark and look how well our community does to others. And then again, it allows for access to that nurse health line. That is one piece of a pie. Not every patient is eligible to go over to the nurse for many reasons, but that is one sliver of a pie that we are taking to safely navigate patients so that we ensure that emergency resources are available for emergencies. And with that, I appreciate the time. I'll be happy to answer any questions you have.
Any questions? Anybody on Zoom with any questions or comments?
A very good presentation. Really good.
Thank you, John.
Appreciate that. Appreciate that.
Mike, you have anything you want to share?
Do you need this microphone? Nice presentation. Thank you.
Thank you, Mr.
What's the average? How many calls go over to the nurse hotline per year, do you think? Do you have a number?
I just did a presentation on that, and so approximately about 1,500 calls go over to the nurse health line each year, and it is 20% of our volume. So we respond on about 84,000 calls. 20% of that is eligible. There are many reasons why a call can't go over to the nurse health line. A doctor may be on scene. It's a public assist. We recently removed the one of the things when community members would call is they would say, I don't want to talk to a nurse, I want to talk to I would like an ambulance. And so that still is afforded to them, but we do transfer them over to the nurses to try and get them to understand that we know that transportation's a barrier. And Remsa Health right now will pay for individuals that are calling with low acuity complaints, and we will arrange either a taxi or we're working with rideshare right now to be able to set up transportation. And one of the things we've seen is more patients, again, they do need care. They just don't necessarily need it in the back of an ambulance. And so it allows for us to break down one of the barriers that previously prevented them from being transferred over. And so I anticipate that as we continue to evolve, that we will see more and more patients go over.
One more too. I didn't see it covered in there, but you know, what you mentioned best practices, and you 5.2, REMS is responsible for coordinating all EMS radio traffic for patient reports to area hospitals and will record these transactions. Is there any plans in the future to bring the system over to the 800 megahertz system that is now the statewide communication system, seeing how they abandoned UHF frequency several years ago, and I know you guys maintain those?
I would love that. So initially, we were a sponsored agency, and actually currently we're a sponsored agency, but I know that there is interest from our organizations to work to migrate either over to 800. The hospitals, you know, hospital radio reports in general across the nation are evolving as to how we're communicating patients are coming to them. A lot of places are using text or mobile devices, or they're calling directly onto phones. And you know, interestingly, as our community grows and as more hospitals and FEDs enter our region, we're going to have to figure out something, because the current med system radio, it just doesn't have the capacity. It is antiquated. It's a good backup system, but I'm interested in, and we also know there's limitations for us to migrate over to 800 right now due to the lack of LIDs. But as we go over to the 800 system as a region, or the updated system as a region, we definitely have interest in looking and evaluating that. And it is my opinion that that's something in which we should do.
Cool. Well, there's going to be more conversation about this. And I do want to say to our region, and I say that to all of our stakeholders from Reno to the county to Sparks, they're working together and with REMSA, and there'll be changes coming. And I say that my hope is for us just to understand our role. And that's part of why I'm bringing this in front of us, is that as decisions are made, that we understand what it is that we're asked to make decisions of. Some of the things that they're making decisions of are not being asked of us yet, and so that's not our place. There's a part in this that we get to speak into, and I mean, some of us get to do that in different realms. But in the very end, working together for what's best for our community is what I think everyone's trying to do, which I appreciate, and I just encourage that. But I do hope that our health board continues to really pay attention, because whatever is fully decided, how it's laid out right now, we get to be that accountability. But I think accreditation is also important. I want to say this out loud to anybody of the million people listening out there, because even when we're not on this board at some point and you're not working, you retire one day, what we put together is in place to help for the better of our community that has the right standards. And that's what I'm concerned about, is making sure that it's not based upon what we're just dealing with right now, which has a lot of stuff, but that accreditation pushes us to be better and kind of really keep to some things. So thank you for this outline. You did a great job. Barry, be pleased.
Thank you. Thank you.
Okay, we're moving on to 10, recommendation for appointment to the Air Pollution Control Hearing Board as an at-large committee member, and Francisco Vega.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I believe the information has been included in your staff report and along with the division's recommendation. I would just like to highlight a couple of things, which is in this process, just like we have done over the last couple of years, we've kind of exhausted any opportunities to solicit members of the community to apply to be a part of the board. We did issue a press release. That press release was shared on social media, also with our email subscription list. And again, we continue to accept applications indefinitely, but anytime we do have an opening, we will make special or specific efforts to make sure that we get applications during those times. So,
and that's the part I want to say to our board. One of the things that we've done a lot of work on is making sure that anytime something's open is that it truly is open to the community. It doesn't just linger there, and you've done a good job on that. And when that said, it's nothing wrong also, though, in retaining somebody who's doing a good job. So do know that there are people who applied, and Mr. Martin Breitmeyer, I think that's how you say his name. We happy to take your recommendation. We just ask that you continue to do what you just did, just walk through the process, and I thank you for letting us know you did.
Yeah, absolutely. Yeah, so through that process, again, it was very exhaustive. We did receive 6 applicants. We did make a recommendation to retain Mr. Breitmeyer. His expertise and knowledge in the field of construction and development has been really valuable. But I do want to mention that the board is able to make any decision.
Very good. So that is what they would. Our suggestion is Mr. Breitmeyer. Is any other conversation, or do I have a motion in agreement with staff?
Make a motion to reappoint Mr. Breitmeyer for a 3-year period on April 27th to 23rd and concluding on April 26th to the Air Pollution Control Hearing Board.
I have a first. Do I have a second?
Second. I'll second the motion. I'll third the motion.
Good job. Catching on. With no more discussion, let's go ahead and say all in favor?
Aye.
Aye. Passes unanimously.
Thank you.
And if you're out there listening, Mr. Breitmeyer, thank you for serving. These boards are so crucial to what we do. If we had to pay everybody who works for anything we do for our county, cities, we'd be in trouble. We have a lot of volunteers that are just awesome. So I'm trying to get back to presentation and possible acceptance of the FY23 Q3 strategic plan results. Rayona Lavoie. Did I say that right, Lavoie? Hello. Welcome.
Thank you. All right. Good afternoon, members of the board. My name is Rayona Lavoie, and today I'm going to be presenting, let me back up. My name is Rayona Lavoie. I'm a management analyst with the Office of the District
Can you
Health
turn up her
Officer's
mic a little
Office.
bit? I'm sorry, it's hard for me to hear. I want to hear every word, so thank you.
Is this better?
Thank you.
Okay. Today I'm going to be presenting our ClearPoint results for quarter 3. In your board packet, you have a detailed report of all of our results, so I'm going to hit the high notes today. But last time I was here, I was talking about how we were going to switch our reporting. We were previously reporting quarterly up until quarter 3, and then we made the decision to shift to reporting year to date because this will allow us to measure the previous year's data against the current year. It will also give us the opportunity to compare performance across key performance indicators, and that's something that we're striving towards in fiscal year 24. And it'll also provide information so that we can make some growth projections. So that's why we made that shift. Sorry. We are also taking what we're learning from fiscal year 23 and applying that to fiscal year 24. I'll talk a little bit about that at the end of my slides today. But for right now, I want to hit the highlights of all of our progress that our staff have made. Our staff continue to make progress in implementing their initiatives. Over 60% have been completed, and we're well on our way with about 30% in progress. As for our outcomes, staff are on target to meet the outcomes that we set out for fiscal year 23, with over 70% being completed, which takes us to our division goals. About 75% of our division goals have been accomplished. And then when we're taking a look at our district goals, about 80% of those have been achieved, and we have one more quarter to tackle the last of our outcomes and our initiatives, and I believe that our staff will get there with all of the progress that we've made in this last year. So as for next steps, I will be back in August to present an annual report, and I'm going to cover more information about actual projects that we've been implementing so that you'll get information in my presentation about the work that we've been doing and the work that we're really proud of in fiscal year 23. And then right now, we're currently in the process of refreshing our outcomes and initiatives for fiscal year 24. So a lot of those outcomes and initiatives are going to roll over from fiscal year 23, but I'll also be giving you guys an update on fiscal year 24. And then, of course, you'll get all of the information when we convene at our retreat. And with that, I'll take any questions about ClearPoint.
Any questions for Ms. Lavoie? I know it's a lot to keep up with, and so you guys definitely keep things on track. I think the one thing I'd be interested in as we go forward is what roadblocks do you think you're finding? Not today, but when you guys come back, because that's where we can help sometimes. If we know that you guys have these goals and it just, maybe sometimes it's finance, but sometimes it's not even finances.
Yeah.
If there's something, but that would help us as a board, help you, support you as you go forward.
Absolutely, I can include that.
Thank you. This is possible for action. We didn't change anything. Do you need it approved? Okay.
Thank you, Chairman. I just want to acknowledge the hard work of our staff, and we really challenged ourselves to try to get everything in ClearPoint updated within the first few days of the month, so current through the end of March, so that we could bring this to you in April. And so that's our plan moving forward, is to try to bring you current information on our progress under the strategic plan. When we wrap up at the end of the fiscal year, it is going to take us a little longer to make sure it's complete. So that's why we're pointing to August for the next report out. But we may not have every indicator updated just because of the tight time frame to get those updates and to bring it to the board that following month after the quarter. But we think it's more important to try to get you timely information, and maybe it's lacking a few pieces than waiting an extra month before you see how we did with the 2 months.
No, very much. And this is a lot of information. I stayed up all night studying this, actually. I did read through it, but I didn't do it last night. But I do want to say that, like dashboard things, types like what you do here, it does definitely help kind of us pull that together. But I understand what you're saying. I think it's a lot. It's funny, we make these plans to hold ourselves accountable by creating these kind of things. And then afterwards we're like, man, we create a lot of work for ourselves to keep up with everything. That's the reality. But it's important work. It's the same accreditation. It's accountability. So thank you.
Absolutely.
Do I have a motion to accept or any other questions?
Motion to accept the 23Q3 strategic plan results.
I have a first. Do I have a second?
Second, Rika.
All in favor?
Aye.
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 Passes unanimously. Good job. Thank you. Okay. And you get to stay up here for the presentation and discussion on Public Health Accreditation Board. You're an overachiever.
Thank you. Okay. Rayana Lavoie, Management Analyst for the Office of the District Health Officer. In this presentation, I'm going to provide you with some information about accreditation, why it's important to public health, and I'm also going to talk about our reaccreditation efforts. All right, so accreditation is a framework that guides the work of health departments to ensure we provide services and programs that meet national standards that are best practice. I'm going to share some concrete examples with you of how the health district actually does this later in my slides. But if we take a step back for a moment to visualize the vital role that health departments play as being the backbone of our public health system, accreditation drives performance improvement, and it ensures that we have a strong infrastructure and the tools that we need to make sure that we have healthy, safe, and equitable communities. Before I do that, I think it's helpful to understand who the accrediting body is so that you have information about who's looking at our work to determine if we're actually meeting those national standards. FAB is the organization that provides the accreditation program, and the organization receives direction from a board that a lot of you are familiar with. Some of those organizations are here up on the screen, like NACHO, APHA, NALBO. Other district health officers from health departments also sit on this board, but a lot of them are representatives from larger organizations that lay the guidelines for public health to improve our public health system. The formality of going through the accreditation process supports the mission of people living their healthiest lives. Broken down, we do this by delivering the 10 essential public health services. And I know it's really small on the screen, but hopefully you have this in your packet. But as we're being evaluated, we're being assessed by how well we're delivering on these 10 essential public health services. So let me give you some examples of how we do this here at the Health District. To effectively provide public health services, one of the main activities that we have to do are assessments, because this gives us the ability to investigate or diagnose challenges or problems to identify interventions that will improve public health. So one way that we do this is through our community health assessment. A lot of you have received a presentation on our community health assessment. But after we're done looking at our quality of life indicators and illness and disease here in Washoe County, we then take all of that and then we turn it into a community health improvement plan by working with the community to leverage our resources to make some action to improve the health. Another way that we do this, essential public health, is also providing effective communications. So when we were in the thick of the pandemic, it was really important that we were ensuring that folks knew where to go to get tested, what vaccines looked like, but this is part of that wheel. Right now, we're working on a rebranding strategy, so we want to make sure that people in our community know about our brand, what we do, and the services that we provide so that we can improve their health. Here are some other examples of what we do here at the Health District. Through that assessment process, we also do disease investigations to stop the spread of outbreaks or illnesses that could be infectious. Good public health is also providing equitable access. One way we do this is through our clinic, where we provide walk-in appointments as well as our night clinics. And then we also have a component where public health is enforcing regulatory actions to ensure restaurants are providing food safely. We also have regulatory standards to ensure our air pollution is managed appropriately. So those are just some of the examples around the wheel that we're doing here at the Health Districts, and I can continue to give you guys examples, but again, just some of the examples that we do. I briefly touched on the impact of accreditation, but accreditation provides a lot of benefits that have helped us grow as an organization. One thing that we're doing right now is we're really focused on equity. Accreditation sets a standard to ensure we're approaching our work with an equity lens. And so our team earlier today, they just received the Impact Awards from Washoe County, because this is ensuring that we have diverse voices around the table to make sure that we are addressing health disparities that are culturally appropriate. Accreditation is also about a culture of continuous improvement so that our teams continue to look at the programs and services that we provide so that we can manage our resources, or we can take a look at our resources in our changing environment to ensure that we're providing the best programs and services that meet the community's needs. So now I'm going to touch on the process of accreditation. This is the shortened version of the process, but to be accredited, it's a very rigorous process, and you first have to pass a readiness assessment. After you've passed the readiness assessment, you have to gather documentation to be able to demonstrate that you're delivering on those 10 essential public health services. Once you've gathered all of those documents, there are about 400 in the initial accreditation process. You have a FAB team that comes out who will complete a site visit, and they'll take a look at those documents and also talk to subject matter experts from your organization to determine what your accreditation status is, to really see, are you meeting those national standards? Once FAB makes their accreditation decision, you then have to start providing annual reports if you're accredited. So we are one of 500 health departments in the nation who are accredited. And so we've been reporting on our annual reports from years 2 through 4 because it's a 5-year cycle. And so that's where we're at right now. So let me give you an idea of what we get to do. So we were accredited in 2019. And like I said, since then, we've been submitting our annual reports to demonstrate our continuous improvement. Some of the things that they like to see that we're touching on is performance management, quality improvement. When COVID was here, they wanted to know how we were delivering our services. Those are just a few examples. But I will say, above just being an accredited health district, Washoe County Health District has been recognized as a top performer across the nation. And some of the things that they recognized our staff for being innovative is around our COVID delivery, our performance management, as well as some of our publications that we've put out. So those are just to name a few, but FAB continuously recognizes us for our innovation. So that's kudos to staff. And let's talk about next steps. So now that we are approaching 2024, we're about to hit our 5-year mark. So we're up for reaccreditation. So we're getting ready to prepare what that package is going to look like. In reaccreditation, there's about 300 documents that we need to gather. And so we've convened a FAB committee of subject matter experts from all of our divisions who are going to help us get all of these documents together. And then we apply for reaccreditation in July of 2024. And with that, I'll take any questions that you might have.
Any questions from the board? I have a couple. One is on this process that's coming up, where are we involved as a board?
That's a great question. Kevin, do you want to answer that question?
Well, the accreditation does include some of how we work with the board on governance stuff, so they do look at that. The board is really, though, the body that's responsible for the decision that we want to be an accredited health district. And so we document how we work with the board and how that board governance occurs. But there is not like a direct site visit, sit down with the board members as far as the types of documentation that we have to provide for accreditation.
Well, please let us know if there is. And other accreditations I'm on, the board is very involved. So it's a different process. But each probably has its own life. But
yeah, and you know, if you want to have updates as we move along as to how we're progressing, we're happy to provide those. We're just getting started, and we got a year's work ahead of us.
Well, I'm going to say, yeah, I think it's important. And part of it is, the next question is, how do we properly advertise we're accredited? I think we do a lot of work to get accredited, and I think it's very important we are. I think somewhere in our advertising, especially as we're re-educating our community with our new thing, this needs to be like the star that's sitting on our logo, that we're accredited. I mean, that's, and even if they don't know what it means, they'll start telling people, yeah, we're accredited. You know, it's just a very good thing, but we know it's important. And it does help. And I do think it also helps with when we come up with ideas or we're looking for grants or any of that stuff. It's so crucial. So that'd be one push that I know we've been accredited for years, 5 years now. But I don't know that if we went and asked even elected officials besides those on this board, if we are, they couldn't tell you, you know, and we do try to pay attention. So anyway, I'd like to see us really probably find one. So thank you.
If I could just add one thing, I guess the other thing I should have mentioned is the strategic plan is a really, really important piece of our accreditation. So it's actually a prerequisite for accreditation, and so that's also another measure of the board's engagement and what is the strategic plan that we operate under. And then perhaps Scott, with the rebranding campaign, we can push accreditation.
Cool.
Thanks.
Thank you so much.
You're welcome.
And that's not an action item, I understand, correct? That was just an update? Okay. Okay, on to discussion and possible direction regarding legislative issues regarding the 82nd Nevada legislation session. Come on down in the nice, lovely pink dress. I know you'd rather be in Carson City right now, but thank you for gracing us with your presence.
Good afternoon, board. Good to see you. This will be a short update, hopefully. We're in day 81, 39 days to go. And yesterday, or the 25th, I don't know what today is, the 25th was the first House deadline. And only 10 bills died, so it wasn't that eventful. Just a lot of floor sessions where they vote bills out of the floor and into the next House or to a finance committee. So I'll start with AB 53, which is the Attorney General's tobacco. They have a bill every session relating to the sales of tobacco, and this is where we modified some of the fines and penalty structures. It didn't go as far as we'd wanted. However, we did get rid of the 2 warnings for the license holder. And now it's a pretty substantial fine. The first fine is $2,500. The second fine is $5,000. And the third fine is $7,500. We wanted that to be a revocation or suspension of license. There was no appetite for that. It's also near impossible to get to that third fine anyways. So we're still working on it, but that's where it is right now. And it was referred to revenue in the Senate side. So there are some things we still would like to see. Instead of every 24 months, the clock resetting, we'd like to see that every 36 months. And we're trying to get the Attorney General's office to agree to that. They haven't so far. So that's where we are. All of the tobacco prevention groups will be opposing the bill because it's still pretty weak in terms of national standards. So that's AB 53. AB 357 is a opt-out instead of opt-in for sexual education this session. That bill passed and is now in Ways and Means. I was not involved in this bill, but it is still alive. It's trying to keep it just updated to evidence-based, scientific, up-to-date, and instead of an opt-in, an opt-out. So no very controversial items, but it always becomes controversial. SB 92, which has been our favorite bill of the session for so many industries, is the street food vending bill. That passed out, and it is now sitting in government affairs on the assembly side. I spoke to Senator Dunyate yesterday evening about a couple of concerns we have with the regulatory process in this bill. Right now, it asks us to amend and fix some regulations by, I want to say July 1, 2024, or January 1, 2024, and that's just not enough time. And he agreed that because there's a task force being implemented in this bill, why don't we have the task force meet, have the task force have a due date of December 1, 2024. Yeah, December 1, 2024. Then we'll talk about it during the legislative session, and then we'll update regs after the next legislative session. So the regs would be due January 1, 2025.
Six.
Yeah, 2026. So I'm amending that for him. It may not be, the regs may be, no, it would be January 1, 2026. Yes, sorry. So that's what we're amending there. And everybody can agree to that. Gaming, Clark County, the cities are all okay with that. It's still not ideal. We, as a our food safety team doesn't feel like it addresses the issue of unpermitted food vendors, and it doesn't. But this is what the bill is right now. It doesn't change what we do as the health district. So we will see how this unfolds.
I just want to speak to that for a second. This is one I've been concerned about as we've gone. And so one of the things, there's two concerns I have, and hopefully this gets all the way to Carson City. I don't like legislators reaching in to do the job that we do. There's a reason we do our job. And as a city, as a county, in our area, we make these decisions. And if there's a concern, we're willing to work with them. I mean, and we actually can get it done quicker with less hemorrhaging anyway. But on the other note, I am concerned that even if this goes forward, it sounds like it's a fine bill right now. We can live with it.
We can live with
it. But the problem is it builds. This is the first time, and they get their foot in the door, and then they push to this and this and this. And so I'd be very concerned about that task force group and what they come up with to push for the next round or any of those kind of things.
Well, two things. I don't know if you've seen the latest, but the cities are okay with this now, more okay with it than they were, because it essentially makes it illegal to have food vending almost anywhere in the city of Sparks or the city of Reno right now.
Oh, wow.
It's 1,500 feet from a gaming institution. There's certain distances from any bar, any tavern, any restaurant. Then there's the right-of-ways that cities are able to make their own stipulations for, as well as counties. So this is really, the act is really going towards, they want to make it okay for permitted vendors to vend in residential areas. However, the cities and the counties are able to create what they want to create around that. So I think this became a worse bill for them.
I think it sounds like it's not even the intent I would
However,
want.
gaming's thrilled with it, and we'll just see how it works. And then the makeup of the task force is going to be it's a voting task force, and it's a 9-person committee, which will have about 4 representatives from like cities, counties, health district, and then some permit holders, I guess, or food vendors, or representation from food vending. So the recommendations will be, it's an even representation.
Okay.
So it won't be an uneven, the recommendations won't be unvetted by both sides. So I think
it does sound better.
It's landed where governments can live with it.
Oh, thank you. Okay.
Clark County's having the hardest problem right now because they need some ordinances enacted by Formula One, which is November. So they have to get some ordinances done by October 1, and that's a really quick turnaround. But that is, we do not live in Clark County. So that's SB 92. SB 118, our favorite bill of the session, was amended with an amendment that Megan Kamlasi and I wrote, that instead of asking for that one-shot general fund every session, that $15 million annually, we got, it was amended in that we would be getting a sustainable source of income from the other tobacco product 35% of the annual revenue from the OTP tax. And that would be distributed to us annually. However, I just saw the bill kind of in its form, and it still has it go through the state. And I think if we can change that, it would be a direct distribution, just because we have trouble getting money from the state on time. And they don't disagree with that. It's just the way the bill was written. So we're going to work on that on the other side and see if we can get that just a direct allocation.
It's good.
So that's turning out well. That is now in finance, where about 200 bills are sitting right now. And they don't want to move anything until the Economic Forum, which is May 1. But that leaves a lot of bills and not a lot of time. But we're meeting with the whole Senate Finance Committee in the next few days. We've met with them, most of them. We met with some of them this week and the rest next week, just to push the bill.
And to our board, if that does pass, and that does mean income coming to us, that we would, led by staff and Director Dick, there would be conversations on how that functions at that point. So there's nothing really to talk about until something passes anyway.
Yeah.
And they'll have guidelines and stuff. But that could be very helpful to some of the things we want to see happen in our community.
Yeah, and it stipulates, it's how we look at what our priorities are, and then our reporting mechanism back to the IFC 90 days after we get the money, 90 days after the fiscal year is over.
Very good. Thank you.
So that's 118. SB 172 was the minor consent bill for preventative treatment instead of being able to just for STIs. Right now we can treat an STI, but we can't prevent an STI. So that was permissive language to let us treat a minor without parental consent for STI, like PrEP and things like that. That did pass out mostly on party lines. Senator Heidi Gansert voted for it because it's a healthcare issue. So that went to, that's now in Assembly HHS. So we'll see where that goes. SB 361, another bill that gave environmental health some heartache. It was about solid waste, trying to kind of exempt a population, a certain industry of solid waste. We met with the bill sponsors. We could not come to an agreement, and that bill died the week before last. So that's off of our plates right now. SB 441 is the bill that repeals SB 4 from the special session during the pandemic. That bill was voted out last week. 3 Democrats voted against it, but everybody else voted for it. It's a culinary versus gaming politics feud. However, for us, we believe that should be repealed. We believe our current standards meet health expectations and sanitation expectations. So that bill is in Commerce and Labor now and will be heard on Monday, and we will be supporting that bill. And those are the updates I have this week, this month.
Thank you so much. Thanks for presenting. Any questions?
Any questions?
Very good. Thank you so much.
All right. Thank you.
That says for possible action. Would you like us to accept that? We don't have any direction. Okay, thank you. So we'll go just take that as a report. We'll go on to our staff report, and we have Francisco Vega with our air quality management.
Thank you, Chair. Members of the board, for the record, Francisco Vega, Director of the Air Quality Management Division. Just want to highlight one thing from my report, and that was that we did comment in regards to EPA's reconsideration of the PM 2.5 National Ambient Air Quality Standard. If you recall, it was probably several months ago, but we had committed to the board to keep them updated on any changes or potential changes to the ambient air quality standards. Again, typically those are reviewed by EPA once every 5 years. EPA is taking a look at the particulate matter standard right now. In fact, they are looking to lower the annual PM 2.0 standard in the range of 9 to 10 micrograms per meter cubed. Essentially, what our comment letter did say is that we support any standards that are based on the most current scientific data. So that was pretty general comment. The other part that we did comment on is in regards to the process for compliance with the ambient air quality standards. Again, we have been impacted by wildfires over the last several years. We are currently going through a process which helps us, again, attain the standard where we have to prove to EPA that the data that is exceeding the standard was due to wildfires. And again, I put in my report that there's 4 events that we have to potentially exclude from our data in order to, again, stay in attainment of the standard. And again, one of the events has taken us 150 hours of staff time.
Wow.
So a considerable amount of time, and that's not anything different than any other air quality jurisdictions are going through on the West. So again, we commented in that, please EPA either provide resources or assistance in streamlining this effort. Again, there's nothing we can do about the wildfires as far as how it impacts our attainment of the standard. So that was the other part we commented on.
Wasn't California going to pay for those hours? I'm just kidding. They're not. Sorry. I do have one question on your thing here, though.
Yeah.
Your environmental justice bill.
Yes.
You mentioned that it's going to have significant training for air quality staff. Is that going to require some funding? Is that something that is going to just be able to be wrapped into the time that you have? Do we need to send you guys somewhere for that if this thing passes, as you shared?
Yeah, so it is obviously something we're keeping track of. If it is passed as currently proposed, it would require significant training and probably increase some resources as far as turning around permits and things like that. And I'm sorry, what was your? I apologize.
I just wanted the board to be aware if you come back and there's an increase of something that we understand it's not out of nowhere. This environmental justice bill may bring something to the table. So
correct.
If that's something that is there a shift of anything in your mind that's going to need to happen?
Yeah, we're hoping again. The likelihood of this passing federal legislation is not very likely, but it is something that's under review right now.
Okay.
And again, if it does go through, we will have time to put resources in place in order to address any kind of requirements.
Thank you.
Yep.
Okay.
Yes.
Any other questions?
Yeah.
Thank you.
Yep, thank
I
you.
appreciate it. And Lisa Latritz, come on down. Community and Clinical Health Services.
Yes, Lisa Latritz, Division Director for Community and Clinical Health Services, for the record. So just a couple things to add to my report. Just an update on COVID vaccinations. Since we last met, both the monovalent Pfizer and Moderna have been discontinued. I think last month it was we just had Moderna, so they did discontinue monovalent Pfizer. And there is a new bivalent schedule. And they're hoping to simplify things, but it is still pretty complicated. So the dosing regimen and dosing schedule is based on age and the number of previous doses received. So I'm not going to go through it with you, but there is a new dosing schedule. And individuals can still receive the Novavax, and the dosing regimen and schedule has not changed for this vaccine. Individuals 65 and older are now eligible for a second bivalent booster if it's been 4 months since their previous one. So that's good news. And then we're still sorting out the immunocompromised second booster. That one, the FDA did, in their approve it 2 months after someone that's immunocompromised had a booster, they could have a second one. But in the CDC guidance, it says still to come. And so we're referring people back to their provider at this point because we wouldn't be able to give that just based on someone self-attesting that they are immunocompromised. So we should have further guidance soon, but that one's still a little more confusing than the others. But we'll keep you posted. And then the other thing I wanted to update is on our This month's program that we featured is our sexually transmitted infection. It's Sexually Transmitted Infection Awareness Month, and I have an update that Jen provided for me. So 2021 data was released after we submitted our report. While Nevada moved down in the rankings, the rates increased for Nevada and other states. The data shows that STIs have reached a new record high for an 8th year in a row. There has been a 74% increase in syphilis over 5 years nationally, as well as more than 2,800 congenital syphilis cases. Chlamydia rates have risen to pre-pandemic levels, and gonorrhea cases are increasing. HIV cases remain stable statewide and nationally. However, Washoe County is experiencing a rapid increase of HIV cases that puts our case count at 22 currently, which usually occurs at mid-year for us. There were 13 cases reported between March and mid-April of HIV. And then lastly, this is exciting, the Family Planning and Sexual Health Clinic, their walk-in appointments for March, they continue to be well received by the community, and 46% of all of our appointments in March were walk-ins. So people are liking that, and we'll just continue to offer it and hopefully increase it.
Very good.
I'm happy to answer any questions.
Any questions?
Okay,
Gotcha.
thank you.
Thank you. We're on to Environmental Health Services, Aaron Dixon.
Good afternoon. For the record, Aaron Dixon with Environmental Health Services. In honor of Earth Day, the program highlight is about our strong relationship with KTMB, where we received some funds that we are able to pass on to KTMB, and we've had this relationship for many, many years. There's two major categories we work on with them is waste removal and waste reduction. Both of those we're very proud of. A few other things I'd like to highlight from our food program. Our EPI program, in conjunction with the communicable disease team, investigated a very large foodborne illness outbreak that resulted, it was at a high school event. We had 30 foodborne illness complaints. We received samples or specimens from 11 individuals, and all 11 came back positive for norovirus. So it was a huge lift on the team, but also great job working together and really being able to identify what the cause was for that. For land development, a letter of support was sent to the city of Reno, signed by Mr. Dick, for a federal grant they're pursuing that would allow them to perform a large a septic to sewer conversion for approximately 110 homes right over here off of Whittakin. So many people don't realize that right here kind of in town that they are still being serviced by septics, and they're very small lots. In addition, the Safe Drinking Water team, they are gearing up for the lead and copper rule, where some of our water systems are going to have to test and see the lead and copper levels and then report back on that. And then finally, for our vector program, the drones have arrived, and we are now completing all the necessary paperwork. There's a lot of it, and we'll be moving forward with that. So I'm available if you have any questions.
I think my only question is, next year for Earth Day, can we plant a tree or something? I think it'd be really cool to actually make that something that we use as part of advertising for what you do. And I know City of Sparks, we did that. I had to miss it today, but it'd been fun to take a time of some sort. And
we can definitely do something in honor of Earth Day.
I think it'd be really cool to do.
Okay. I'll write that down. Thank you.
Okay. Any other questions? Okay. Epidemiology and public health preparedness. Dr. Nancy Dow. Even Dr. Nancy Dow wants to plant a tree. I can tell. She's excited about it too.
Yes, I love the tree idea. Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I just have two quick little updates since then. There has been discussions on the creation of a data sharing agreement between our EMS oversight program, City of Reno, City of Sparks, Remsa Health, and Truckee Meadows Fire Protection Agency that's been ongoing since September of 2022. The creation of this data sharing agreement provides for easier sharing of data between agencies in order to support needs and quality assurance and improvement purposes. And the program was able to, under this agreement, provide secure access to specific data for the agency who requests the data needs. So the agreement was able to receive final signatures earlier this month, and the agreement has an effective date of April 30th of this month. The program is still working on with vendors and with the Washoe County Technology Services to complete the technological side of the Secure Data Web Client Portal, and we hope to have that completed very soon. And also, on another note, our COVID-19 testing operations, we will be moving to only homebound or home visit testing starting on May 23rd due to our drive-through being having our testing numbers consistently low for quite some time, but we would also like to continuing testing support, especially for those who are in need living for places such as assisted living facilities. So that's all my update. I'm happy to answer any questions you may have.
Thank you. Any questions? I think we're good, and that's a good report. Thank you.
Thank you.
And now we're on to District Board of Health Officer Kevin Dick. What you have to share with us today?
Thank you, Chairman. I just wanted to a brief update on regionalization that was touched on earlier. We've been kind of in a hiatus as the Federal Engineering, the firm that is working to support that effort, is working on a gap analysis and recommendations document. So we haven't had any meetings since March 23rd, but we've got a full-day workshop coming up on May 11th. That's going to be a workshop on governance for regionalization. And then on May 30th, the Federal Engineering will be back, and we'll have another full day for final deliverables and recommendations workshops on next steps moving forward. So hopefully we'll have a lot more information to report after those May meetings. I just wanted to make a correction on my report on SB 19. I included that the amendment set distances that sidewalk vendors couldn't operate from schools. I made that error because when I wrote this, the amendment that had been passed had not been posted. So one of those things where nobody really knows what the amendment is. So that was in a previous amendment. But the bill does allow cities and counties to establish additional exclusion areas. So that's something that might be considered locally. I know we do get complaints of unpermitted street vendors around schools here in northern Nevada. And then also just wanted to mention and thank our chairman, Dare, who hosted a Public Health Week employee recognition breakfast on April 7th, and was there. I actually serenaded Health District staff, and also wanted to thank.
You should have come. I sang for you.
Dr. Danko as well for coming over for that event, and then also wanted to thank Commissioner Garcia, who attended our Health Heroes Luncheon on April 20th to help with recognizing staff. And that was a busy day. I want to also thank Chairman Dare, who attended the Washoe Impact Awards luncheon to help in recognizing our staff at that event. So that concludes my report. Happy to take any
thank you. And I do want to say, I think we're committed to a lunch next year. So if you didn't get to make breakfast, don't miss our lunch. I think it might even be a barbecue of some sort. So I could see you out there with a nice apron on, flipping some chicken. So, but anyway, it was fantastic to have everyone there, and congratulations to you all. It's important that we pause to say thank you for your hard work. Thank you, sir. Any questions for Mr. Dick? And I see none. Any other board comments that we'd like to say before we finish out? I don't see any, so we're going to go ahead and adjourn. Have a great day. Thank you all.
Have a good day, everybody. Thank you.